Hi, I'm Brad,
And I'm Shay.
and we're going to do our evidence-based practice video over the National Institute of Health Stroke Scale. I'll be performing one on Shay, who'll be the patient here.
The National Institute of Health Stroke Scale is a systematic assessment tool that provides a quantitative measure of stroke-related neurologic defects. The NIHSS was originally designed as a research tool to measure baseline data on patients in acute stroke clinical trials. Now the scale is also widely used as a clinical assessment tool to evaluate acuity of stroke patients, determine appropriate treatment, and to predict patient outcome.
The NIH Stroke Scale can be used as a clinical stroke assessment tool to evaluate and document neurological status in acute stroke patients. The stroke scale is valid for predicting lesion size and can serve as a measure of stroke severity. The NIHSS has been shown to be a predictor of both short and long-term outcome of stroke patients. Additionally, the stroke scale serves as a data collection tool for planning patient care and provides a common language and information exchanges among healthcare providers.
The scale is designed to be a simple, valid, and reliable tool that can also be administered at the bedside consistently by physicians, nurses, or therapists.
The NIHSS is a 15-item neurological examination stroke scale used to evaluate the effect of acute cerebral infarction on the levels of consciousness, language, neglect, visual field loss, extraocular movement, motor strength, ataxia, dysarthria, and sensory loss. A trained observer rates the patient's ability to answer questions and perform activities. Ratings for each item are scored with 3 to 5 grades, with 0 as normal, and there is an allowance for untestable items. The single patient assessment requires less than 10 minutes to complete. The tools you will need is a pen, the scoring sheet, as well as the picture sheets at the bedside. Hello, Mr. Hake. How are you doing today?
Pretty well.
My name's Brad. I'm going to be performing a stroke scale assessment up and down on you. Is that okay?
Yep.
Are you in any pain at all right now?
Yeah, I'm pretty comfortable right now.
You comfortable right now as well? Okay. Stop. Shay would receive a score of 0 as he does appear to be alert and keenly responsive after asking and verifying that he is comfortable before beginning and starting the scale assessment. Could you tell me your age, Mr. Hake?
24.
24. And do you know what month it is?
No. April?
Correct.
Okay.
For the next set of scoring, Shay would also get a score of 0 because he did answer both questions correctly, as it is the month of April and he is 24 years old. Okay, can you close your eyes for me? And open them. And then can you grab my hand with your left hand here? Good. Can you do the same with your right? Okay, let go. Good. For the level of consciousness commands, Shay would also receive a score of 0 as he did perform both tasks correctly and was able to grip my hand equally bilateral in strength, as well as closing his eyes and open them on command. Now I'm going to need you to see if you can stare at my finger here and just fall from side to side without moving your head. Just use your eyes, okay?
Okay.
Good. For Shay's best gaze, he would also receive a score of 0 as he had no forced deviation in either eyes. Okay, now I'm going to ask you to cover one of your eyes if you can, and I'm going to hold up my fingers, and I want you to just focus your eyes on my nose and let me know how many fingers I'm holding up and when, okay?
Okay. 3. 2. 2. 5.
Okay, and can you switch eyes? Okay, same thing. Just make sure you focus and keep your eyes right here on my nose, okay?
5. 2. 2. 3. 4. 1.
Okay, good. For Shay's visual testing, he would receive a score of 0 as there was no signs of hemanopia in either eye and there was no visual loss. Okay, now I'm going to assess a little facial palsy here. Could you do me a favor and raise your eyebrows for me? Good. And can you smile and show your teeth? Good. Shay would receive a score of 0 for the facial palsy assessment as he did have symmetrical movements in his face. And now I'm going to test your strength here a little bit. I need you to just raise and lift your left arm if you can. And hold it for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. You can put that arm down. Okay, you go ahead and do the same thing with your right arm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Same thing with your legs. And like, don't let them, try not to let them drift back down or anything. There you go. 1, 2, 3, 4, 5. Good. And the same thing with the right leg if you can. 1, 2, 3, 4, 5. Good. For this assessment, Shea would receive a score of 0 again, as there was no drift and he was able to hold his limbs all up for the allotted 10 or 5 seconds in the legs. Now I'm going to assess for some limb ataxia here. What I'll need you to do is if you can take your pointer finger, your index finger, and put it on your nose and touch my finger here and take it back and do the same. Good. And can you use your other finger as well? Try with your right. Here we go. Nothing, nose, there you go. Good. Okay, now I'm going to check for your legs here. What I'll need you to do is take your right heel and put it on your left knee and rub it up and down your shin if you can. Good. And same thing with the left heel on your right knee, up and down your right shin if you can. Good.
It doesn't really matter.
For the limb ataxia portion of this assessment, Shea would receive a score of 0 as there was no limb ataxia present in all 4 of his extremities. Alright, now I'm going to go ahead and test you for any sensory deficits at all. So I've got a pencil right here. On one end it's got the sharp writing side of it, and the other side it's got the dull, it's a rubber eraser. So I'm going to prick you bilaterally on your arms, face, and your legs, and I just need you to tell me when you do feel it and if the sensory feels sharp or dull or not. Okay, so go ahead and close your eyes for me.
Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull.
Good. For the sensory portion of this assessment, Shea would score a 0 as there is no sensory loss on any of his extremities. Okay, now I'm going to do a little comprehension and language testing on you here, just to assess that a little bit. I'm going to show you a picture right here, and I need you to describe what's going on in this picture for me if you can, okay?
Okay. There's a woman doing dishes, and the sink is overflowing. There's some kids climbing on a stool to get a cookie jar, and the little boy's about to fall down.
Okay, good. And now, what about these objects right here in this picture? Can you tell me what these are?
There's a glove, a key, a cactus, a chair, a feather, and a hammock.
Good. Now, if you can read these sentences, these phrases here for me.
You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night.
Okay. And what about these words right down here?
Mama, tip top, 50, 50, thanks, Huckleberry, baseball player.
Good. That's up. For the best language portion of this assessment, Shea would receive a score of 0 as there was no apparent aphasia, and for the dysarthria section, Shea would also receive a score of 0 as there was no forms of dysarthria or slurred speech when Shea was reading the list of words and sentences back to me. Alright, for this last little bit of assessment, what I'm going to need you to do is still focus your eyes, like as we did earlier, on my nose here, and I'm just going to hold up some fingers, and you just let me know when I wiggle my fingers on my right, on your right, your left, or on both, okay?
Okay.
So go ahead, just fix your eyes on my nose here.
Left. Right. Both. Both. Left. Right. Left. Both. Both.
Good. When assessing for any signs of neglect, Shea would receive a score of 0 as there was no abnormalities and he was able to tell me correctly which fingers I was holding and wiggling up on both sides and when. After performing the NIH Stroke Scale assessment on Shea, he was an ideal, healthy patient with no stroke abnormalities and did receive a score of 0. As you see in front of us, the scoring scale is there to help decipher the severity of the stroke. That was our mock-up demo of the NIH Stroke Scale assessment. Appreciate your time. Thanks for watching. Hopefully it was informative and hope you enjoyed. Atta buddy. We might need to start over.